Today is International Workers' Memorial Day. It's always a sombre occasion for the labour movement, but this year it's especially poignant because it comes in the middle of a devastating coronavirus pandemic and the resulting deaths of many workers around the world. This virus did not inevitably become a deadly pandemic. That's a result of the capitalist system's drive for profit over the health and lives of ordinary people, its inability to plan resources, and decades of attacks on health services. Today we remember those key workers who have lost their lives, partly due to the lack of sufficient personal protective equipment to enable them to carry out their jobs safely. We stand in solidarity with them, their families and their colleagues. Every day we hear of more NHS workers who have died from coronavirus, and every day families of the victims talk about their battles for PPE. Socialist Alternative member and ICU nurse Jacqui spoke recently.
For the last 2 weeks, we've had to sit there and witness Tory politicians joining millions of people coming out onto their doorsteps and applauding us. But 25 healthcare workers that we know of have died in the last 2 weeks because of a lack of PPE in their job roles. So the hypocrisy, I think, is naked and bare for everybody to see. And despite concerted efforts to minimise the number of COVID deaths that are reported by excluding people who die outside of hospitals, the death toll continues to rise at an alarming rate. We had 2 healthcare assistants last week, John Lagos and Thomas Harvey, both of whom were healthcare assistants in the London area. Both died at home, gasping for breath, their families unable to do anything about it. Providing frontline care, and both had inadequate access to PPE. The mum of John Lagos found her son collapsed after being told that he couldn't go home during his 13-hour shift because of short staffing. By the time the ambulance got there, it was too late. The Trust's attitude has been, well, you know, don't blame us. We followed the guidelines that came from Public Health England. You know, we would never ever want people to work when they're sick. You know, never mind the fact that in reality, most trusts have got draconian sickness policies that are designed to deter workers from going off sick. Never mind the fact that a couple of years ago, most of our trade unions endorsed a pay deal for NHS workers that penalises workers who are off sick from receiving increments. There's a culture of presenteeism within the health service, but all of that aside, the public health guidelines were written with resources in mind. The public health guidelines have demonstrated themselves to be wholly inadequate. They have not protected healthcare workers from dying from what is, for us anyway, essentially an industrial disease. And in any case, in a lot of places, the public health guidelines are pie in the sky because people don't have the PPE that they're supposed to. They're making it up as they go along. There were nurses who were wearing bin liners last week and testing positive this week. So when Matt Hancock says we've got the PPE, it's just difficult to get it to where it needs to be. First of all, there are a lot of people who are highly sceptical about that. And secondly, when it is getting to where it needs to be, it is not because the government have made it so or the system is set up to allow that to happen. It is because of the heroic efforts of the workers on the ground in ensuring that the PPE is where it needs to be.
There are those in community health, GPs, and especially those working in the care sector who are likely to be finding access to proper PPE even more difficult. Here's GP Jacqui Grunsell.
Hi, I'm Jacqui. I'm a GP and a member of Socialist Alternative. In the past few days, we've heard reports of 3 doctors dying due to coronavirus, one of whom was a GP. Unfortunately, my first thought in this situation was I wonder if they had access to adequate personal protective equipment and whether their deaths were in fact avoidable. Because despite several weeks now of promises of PPP on its way, we're still relying on dwindling stocks of these kinds of aprons and these kinds of masks, which really aren't adequate if we're actually seeing patients who have symptoms of the condition.
And it's not only those in health and social care. Proper protection is vital for all workers still having to go to work, and especially with public-facing roles. For example, at least 26 transport workers are known to have died so far. London bus driver Joanne explains some of the issues.
The problems we have in London is TfL dragging their heels with all the things they should be doing to make it safer, cleaning of the buses, distribution of PPE, masks, gloves, all this sort of thing. And also the fact that we've been demanding from day one that the front of the buses are sealed and people come on through the middle doors, much like they've been doing across Europe. But still they're dragging their heels. They're trialling it in one of the garages, so probably about 30 buses. We've got 9,500 out there that are not being done. How much trialling do we need to do? We've trialled people dying, that seems to work. So let's try and save them. And I think rather than trialling this thing, they should just get on and do it. It's been very difficult. Bus drivers, I've even had reports of some of our members being spat at by people shouting, "I've got coronavirus." Now, what we've done in London buses to combat any of this sort of thing going on is that they've covered up the talking holes in the assault screen, so people can't talk. But there are huge gaps underneath and around the oyster reader as people get on the bus. So unless this virus has become the size of a football, which I very much doubt, it can still get through. So this is why we're demanding that TfL close the front doors of the buses until this thing's over.
But workers aren't taking this lying down. Already many victories have been won by workers and trade unions getting organised for safer working conditions. For example, since Joanne recorded that video, London bus drivers have won a victory, meaning that passengers only board through the middle doors and do not need to pay them for their journeys to avoid them approaching the driver. In recent days, there have been reports from at least 2 hospitals where nurses have refused to work because of insufficient PPE. We also know the same is true in at least 1 care home, where workers collectively said they were unwilling to work with COVID patients after the management tried to accept people being returned from hospital while still infectious, threatening the lives of staff and other residents. Workers' Memorial Day has a slogan of 2 parts: remember the dead and fight for the living. Workers, communities and trade unions need to be organised to fight for what's needed to save lives. The best defence workers have is using or threatening to use the collective power they have through trade unions. Here, Salford UNISON branch secretary and Socialist Alternative member Steve North talks about the deal care workers have secured in that area.
Hi, my name's Steve North. I'm a UNISON officer in Salford. Prior to the job that I do now, I was a care worker working in mental health. We knew straight away that care workers were going to be at the sharp end of this, not only because of the nature of the job, but because of the fact that they're wholly undervalued. They tend to work for private providers, so they suffer all of the problems that come with the privatisation of services. And a big part of that is the fragmentation as well. It's not just the poor wages and the poor terms and conditions. It's also the fact that services are fragmented amongst multiple providers. So actually getting any sort of consistent terms and conditions is quite difficult to negotiate. So what we did is we mobilised our care workers early on, and we looked to put political pressure on our Labour Council, but also on the local NHS to reach an agreement whereby if care workers needed to be off sick or needed to be off for any other COVID-19 related reason, they wouldn't be out of pocket as a result. And this was really important because we couldn't allow a situation where care workers would have to choose between being ill and potentially infecting other people, or being at home and getting statutory sick pay, or in some cases no pay at all. So what we were able to negotiate in quite a short space of time was a deal whereby if any care worker was off for reasons related to COVID-19, they would be paid 100% of their average wage, not just their contractual minimum, but their average wage for the first 2 weeks, and then 80% of that wage for up to a further 10 weeks. Now, we know that's not perfect, and we're pushing to get that to 100%, but by getting that in place for care workers, not only if they're sick or self-isolating, but also if they're in one of the vulnerable categories, if they're required to shield, or if they live with someone who's required to shield, we've been able to provide a safety net that means that care workers are not having to go in work when they're sick and then potentially contaminating other people. So we'll keep fighting for care workers. As far as we're concerned, care should be delivered publicly. These people should be employed in the public sector. There should be parity with the NHS. And we hope that one of the things that comes out of this pandemic is a recognition that the care workers of this country are absolutely vital. They need to be treated better. And under the system that we live under at the moment and the government we have at the moment, that is not the case. So we'll keep fighting as a trade union, but it's up to socialists everywhere to mobilise in support of care workers. They're heartened and gladdened by the clapping that they see every Thursday night, but they really need us all to get behind them to make sure that they are safe, that they are paid well, and that they are rightly regarded in the place that they should be within our society.
And here, Rob MacArdle speaks about the battle postal workers have taken for safe working.
Hi everyone. Firstly, I want to say solidarity with everyone at this current time. Clearly it's a very difficult situation for all working class people. My name's Paul. I'm a member of Socialist Alternative in Coventry and joined today by Rob MacArdle, also of Socialist Alternative. Rob is a postal worker, a member of the Communication Workers Union, who'll be giving his personal thoughts on what is happening at the moment. So I'm going to ask Rob a few questions so viewers can hear what's happening. Now, one of the features around the world at the moment has been that workers have been forced to carry on working in unsafe conditions without PPE and such like. And there have been many examples in this country as well. And Rob, I was wondering if you could tell us a little bit about the situation for postal workers.
Cheers, Paul. Well, delivering to 30 million addresses across the UK, the Communication Workers Union were rightly concerned about its workers and the lack of cleaning items such as soap, antibacterial gel and gloves. There are also concerns out on delivery with van share, the lack of toilet facilities due to schools, libraries and pubs being on lockdown. The CWU were very proactive. They drew up a list of demands which were presented to senior management, including safe distancing in the workplace and ensuring that workers would not be penalised for absence during the COVID-19 outbreak. Whilst some demands were met, sadly, senior management deemed it a waste of time to have another meeting to discuss the other issues, showing a contempt for the workforce and for those that are on the front line of delivering mail at this time.
Thanks very much, Rob. And as you've sort of started to outline there, the working conditions that many people are facing have led to some instances of industrial action. For example, postal workers and Communication Workers Union members in Edinburgh. I guess I'd like to ask, what do you think of that? And what message do you have for those workers?
Yeah, over the past few days, we've seen walkouts at Edinburgh, Alloa, Chatham and Winchester. And they were right to walk out because of the lack of PPE and the concerns posties had over social distancing and their safety. And why should workers put their lives at risk while senior management are nowhere to be seen during the crisis? The key workers during this pandemic have not been the billionaires, the bosses or the bankers. It's been the low-paid health workers, shop workers and delivery staff. Keeping the country going shouldn't be at the risk of lives. So it's right to demand PPE, safe social distancing and full sick pay at this time. Walkouts can deliver the results needed, and the question of who really runs society can be demonstrated here to ensure that the working class are not the ones to be made to pay for this crisis.
Socialist Alternative fights for the rollout of mass testing, offering key workers and their families tests as a start, but it remains to be seen if this promise is actually delivered on. And we have no faith in the Tories to roll out the community testing that's needed to really get on top of this virus. We fight for the immediate provision of PPE for all who need it. If workers were democratically in control of production and distribution, rather than the system being organised solely on the basis of profit, we could quickly shift production to make what's needed and get it to the front line. Trade unions must be clear that they will back any worker who refuses to work if it's not safe to do so. And we call for a plan of social distancing measures under the democratic control of workers and unions, and based on science. The government tries to shift the blame to a small minority of individuals, not abiding by its guidance, by going to parks or seeing family, but ignores private sector employers who have kept their businesses open unnecessarily. We say that workers in each workplace should democratically decide whether the work is essential, and if not, should take collective action to shut it down. We say no return to work until it's safe, while guaranteeing all workers full pay for the duration of closures. Read our full programme for the fight against coronavirus at socialistalternative.net. Please share this video widely, and when it ends, take part in our virtual protest by taking a selfie with an on-screen poster or sharing the image simultaneously at 11:20. Solidarity.